The overdose crisis. You've probably heard those words on the news, or maybe you've caught the hashtag while scrolling on your phone. But chances are that's not how you're talking about the skyrocketing number of overdose-related deaths in your everyday life. For some, the crisis is your little brother, whose lifelong struggle with drug use has fundamentally shaped your family and who you are as a person. Or it's a story of your community, as you watch your neighbors, friends, and family locked up for drug use and punished rather than given support and treatment. For others, the overdose crisis might be nothing more than a growing death count like all the others we've become so desensitized to. Whether we have felt it up close or only as a faraway problem, we may find it hard to empathize with those impacted by this crisis and have difficulty understanding how we can truly help turn things around. And this is because most of us are in the dark about the nature of drug use and addiction. Most of us learned about drugs as young children, from our schools, our parents, or our favorite shows.
What are you doing? It's a beer! What's the big deal here?
We learned that drugs are things like marijuana, crack, heroin, and that they are bad. We were told that we should make a choice to say no to drugs. That failure to resist the temptation would suggest a moral failure on our part, an inability to know right from wrong, or at the very least would demonstrate weakness and a lack of self-discipline.
Miss Reagan, can I please shake your hand?
Of course you may.
Me too!
We were warned, in no uncertain terms, that making bad choices when it came to drugs meant not only that bad things would happen to us, but that we would deserve those things. Because after all, drug users are dangerous, bad, selfish people, and their misery is their own fault. All this sound familiar? And as we formed our mental image of a drug user or a drug dealer, it's also pretty likely that the racial and ethnic biases of our teachers inadvertently played a role in shaping those characters in our minds. This line of thinking leads us to conclude that the best that we can do as a society to protect people from the ill effects of drugs is to make drugs as difficult to get a hold of as possible, and to seriously punish those who make, sell, and consume them in order to make people think twice before engaging in these behaviors. For most of us, our beliefs around drug use come from a place of earnest misunderstanding. After all, these misconceptions have been repeated to us so many times by trusted experts, and perhaps we've never taken the time to question these beliefs. As a result, we may have inadvertently given our support to policies that make things worse instead of better. But there's a different, more scientifically based, and much more compassionate way for us to think about this issue. The kinds of scary substances discussed on after-school specials might be what comes to our minds when we hear the word drugs. But what about the medications prescribed by your doctor? Or the aspirin you took last week to relieve your headache? What about the drinks you shared with friends over the weekend? Or the coffee that got you going this morning? The reality is, we are all drug users. Drugs are not inherently good or bad. Our relationship to drugs, what drugs we use, how frequently we use them, how they affect our lives, depends on a number of complex factors and cannot be so simplistically reduced to good and bad choices. Our genetics, biology, mental and physical health, underlying trauma, culture, how much money we have, whether we have a stable place to live, and where we grew up all play a role in defining how we relate to drugs at different points in our lives. The science of addiction is complicated, ever-evolving, and impossible to sum up in a sentence. But one easy way for us to think about drug use is this. The stronger your support system, the more connected you are to others, the more you have resources and structures at your disposal that enable you to thrive, the less likely you are to become a high-risk drug user. This is evidenced by the millions of people who, for whatever reason, end up in the hospital and are exposed to highly addictive drugs to cope with pain. But once recovered and back in their supportive environments, do not go on to develop high-risk drug habits. And that's what active users, folks in recovery, scientists, medical experts, and addiction specialists have been telling us for decades. So, if everything we thought we knew about addiction is wrong, why have these misconceptions persisted? And why haven't our drug policies kept up with the science? It's not a coincidence. The reality is that there are those who profit immensely from the distorted reality that we've been sold. And these profiteers, politicians, big pharma, insurance companies, private prisons, have continued to push it on us despite knowing that it doesn't make our communities safer or more healthy. This is the story of our collective failure to respond to a growing public health crisis. This is the story of countless lives ruined or lost while politicians exploited this pain and suffering to maintain their power, and an elite few made billions in profits. This is the story of the war on drugs.